when we're thinking about treating chronic pain, there are sort of five main components. So one is the medical model. And so that might involve tests or an examination or sometimes surgery or injections or pain medications to try and manage the pain. That's only one aspect. And actually, that's not necessarily the aspect that brings people the most relief from their pain. The pain is more related to the nervous system being wound up. And so we do need to move away as doctors and other professionals from over-medicalizing chronic pain.
And a lot of people still think medication will stop pain because that's what we're used to. You know, you have a headache, so you take 2 Panadol. So what's the difference with I've got chronic pain and pain and relief?
It can be hard to shift mindsets. It's hard to shift doctors' mindsets, let alone shifting patients' mindsets about this stuff.
My first aha moment was when I sat with my GP and we were looking at my pain medication regime, and he explained to me how reducing medications would work and what was happening to my body at the moment. And so we started the treatment plan of weaning me off medications and using psychology, exercise, diet to replace it.
We know that people with chronic pain have no choice but to exercise their own capacity for resilience. And it's by helping people to realize even their own capacity for resilience that, again, they build that sense of confidence and self-efficacy to say, even though this hurts, this is important to me and it's important to the things that really matter for me to do this.
Be open to using allied health. They can help you with managing your pain. It's not going to be what you expect. If someone recommends, trying an allied health professional, whether it be a psychologist or, an exercise physiologist, whatever, consider doing it.
That was the question I asked myself. Why do I need to go to a psychologist? But I'll tell you what, that changed my life. That psychologist just helped me so much with the goals that I've set in life.
Now it's, I'd actually do exercise. I've, and I'm not talking about running a 5K marathon or a sprint, but for me it's just, it might be just doing stretches that's been set as a goal, a walking machine that I do my walking on because I find it difficult to go out on roads and paths.
I've got a purpose in life as myself, and I'm the person that has to drive that. I mean, I can't ask somebody else to say what I've got to do.
By using an approach that takes into account multiple different aspects, so your psychological well-being, your physical activity, your nutrition, your connection with other human beings, as well as the medical aspects, we can get better outcomes.